Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echo, vascular, general, high risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. I have the honored guest of Stephanie Mulligan. Her specialty is abdomen and OB/GYN. Stephanie is a dedicated diagnostic medical sonographer with specialties in abdomen and OB/GYN imaging. She currently works at Swedish Radia Imaging Center in Edmonds, Washington, an outpatient facility known for its commitment to quality and patient-centered service. Stephanie began her career in healthcare with a decade of experience in emergency and critical care veterinarian medicine. This is where she honed her skills in high-pressure environments. This foundation inspired her to pursue a career in human healthcare, earning an associate's of Applied Science in Diagnostic Medical Sonography from Rowan College of Burlington County, New Jersey in 2017. She later expanded her expertise with a Bachelor of Science in Health Science, focusing on health administration. Her professional journey includes extensive experience in hospital settings, particularly working overnight shifts, before transitioning to an outpatient imaging center in January of 2022, when she relocated from her home state of New Jersey to the Seattle area. Beyond her career, Stephanie is the proud mom of 2 sons and shares her home with 2 dogs and a cat. In her free time, she enjoys exploring the Pacific Northwest and embracing her new community. Please help me welcome Stephanie Mulligan. Please help me welcome Stephanie Mulligan. Today, we're going to be talking with Stephanie about patient education and the importance of educating our patients and the time that it'll take to educate patients and how to expedite those to elevate our patient satisfaction, really, and reduce the anxiety, I think, for patients. So thank you, Stephanie, for coming on and sharing your expertise in this area, and hope that all of our listeners really can gain a lot of insight from this. So thank you very much for sharing.
Thank you so much for having me. I'm really excited to be here. This is something that I have been passionate about pretty much from the beginning of my ultrasound career. So I'm excited to talk about it and be able to maybe bring some light onto how we can better interact with our patients and make them more aware of their own healthcare and their own bodies. And I think it's something very important that we have a very special role in making that happen.
Yeah, I agree. I think it is vital. In fact, knowing that I was going to do this podcast with you, I was almost more aware of it this week as I was working with patients. So it'll be in your perspective. Tell us a little bit about yourself first and your career journey, maybe, and how you got into it. What caused you to be passionate about just this specific topic?
Sure. So I began my career many years ago. I started in veterinary medicine. I was a veterinary technician for about 10 years. I did the majority of that in emergency and critical care. And that was a very unique position to be in, because a lot of that is educating your clients about their animals, because a lot of people are just completely clueless. They love their pets, but they don't know how to take care of them. They don't know a lot of things. So I started out in that field. And then I kind of decided to go back to school and try something new. And I set my sights on ultrasound. I didn't want to go to nursing school, probably because my family was pushing me to go to nursing school. And I'm a little bit of a rebel in that way. And no, I want to do something different. So
I was encouraged to do the nursing as well.
no, I'm not going to do that. So I went through ultrasound school as an adult, and I've been a tech for about 7 years now, a little going on 8. I began working in a hospital setting overnights, mainly off shift overnights, weekends. The newbie gets the great hours. And I was also in school full time, and I had kids at home. I had 2 kids under 5 at this time. So really my only adult interaction was my patients. And so I became very talkative with them because I didn't get to talk to really anybody else ever.
Right, right.
To know a lot of concerns and questions, common questions that patients had coming through the ER. And yeah, now I'm working in an outpatient facility. And it's different, obviously, than a hospital. The hours are much better. Patients aren't usually in distress as much, or in the hospital setting. But yeah, same thing. I still talk to my patients, and it's just kind of carried through from the beginning until now.
Awesome. Awesome. I think it's such an important role, right? Like I've said this before, but I feel like the ultrasound room is like holy ground, right? Like they come in and we're gonna give them either good news or bad news, right? And to educate them as far as, okay, this is our routine, this is what we're gonna do, and almost like take charge of this experience for
Right.
to educate them. This is the process, this is how it's gonna go, that kind of. And so yeah, let's start out with just maybe general patient interaction and how to kind of start that.
So it's important to have be aware of your patients, and you talk to everybody differently. You kind of have to gauge how somebody is going to best respond to you. I like to keep my appointments with my patients pretty informal. I just talk to them like I would talk to anybody. Hi, how are you? What are you up to today? How's your week been? Just kind of get a feel for where they're at. Some people don't want to talk, and that's fine too. Some people are quiet and they just want to get their test done and leave. But I think it's important to just gauge what a person is, what their mindset is at the time. Do they seem nervous? Do they seem, talkative, like they just want to talk to you? Or do they immediately come out with questions? You just kind of have to feel them out. And yeah, I ask them about their life, ask them about what's going on. And I kind of let them lead, really just let them lead and see where they want to go with it.
Why do you think it's important for us to have patient education?
I think it's important because there's so many patients and just people in general that don't know much about their bodies or much about, the disease processes that they've been diagnosed with, or really anything. A lot of people, I've had patients ask me, what's a bladder? Or, I don't know where that is. People don't know. And I think it's important for healthcare in general for patients to understand more about themselves so they can make more informed decisions and communicate with their doctors more effectively. And doctors don't always have the time or the patience to explain things in a way that people can understand. A lot of doctors don't have that bedside manner where they can explain something and break it down to a person in a way that they can understand and absorb that information. And we're in a unique space because we are not just putting someone in a tube and putting them in a room and stepping away. We are right there with them for usually at least 15 minutes, depending on the study, but we're sitting right next to them and we're able to have that dialogue. And we should all have the education to be able to answer some of their questions. Even though it's obviously a slippery slope, you can't give out results or you can't answer those kind of questions, but you can answer some things, and you can talk to them about things that they've already been told by their doctor, or something that they might be ruling out, or et cetera, et cetera. There's so many things that we can talk to them about, and I just think we're in a good position to be able to do that.
Absolutely. Do you have certain strategies that you use in order to, a lot of our patients come to us pretty anxious, probably, right? And so do you have any strategies that help reduce that anxiety?
Again, I think I just talk to people. In our position, it's a power position, right? We are in the power position, and the patients are not like have the power over them. So I try to just break that down a little bit, and I try not to speak to them in a way that is enhances that power position. I really just try and come down to their level and just talk to them like anybody. And that a lot of times I will notice that it will help people come down a little bit from that anxiety. Or I'll talk about something completely different, get their mind off of it. Again, it just depends on the person and reading them
Yeah.
what will
Yeah,
help them.
I find myself, the holidays are a great a thing that I use to kind of lighten the mood in the room, right? Like, well, how was your holiday?
Mhm.
Not to get their mind off of the actual thing, but just to kind of like lighten the load, right? Like
Mhm.
lighten the heavy.
Right.
So I think that's important. Remind me, what is your specialty? Are you in general?
I'm in general. Yeah. We do quite a bit at my practice now. We do quite a bit of OB, not nothing specialized. We don't do fetal echoes or anything like that, but we do a fair amount of OB.
Okay. So, is there any kind of explanation of technical terms, or I mean, do you go into that a little bit to
Sometimes they do. I have people really asking me why they can't see. This is a big one. They ask me why I can't see their see intestines too well or see their stomach. And I always use the explanation, well, it's we're using sound waves, and sound does not travel that well through gases. It doesn't travel that well through air. So think of a whale, or a dolphin, and how they can talk over miles and miles and miles. It's because sound travels really well through water. Um,
yeah.
and if there's that air in your body, it distorts the picture and we can't see very well. So I try and use examples like that to break it down, and that seems to work most.
Do you ever bring in their any kind of emotional, like empathy or compassion with the technical? Do you combine that at all, or do you really kind of just stay on the technical end of
No, I certainly will bring in the empathy, and I feel for my patients a lot. I've cried with patients, we certainly have those moments. Um, but again, it's the individual, and how comfortable they are. Because again, I'm a stranger. How comfortable? Some people are more comfortable with a stranger, being emotional with
right?
them. Some people are not at
So
all.
a lot of emotional IQ then,
Mhm.
right?
Yes,
Which is
certainly.
something that we don't talk about in ultrasound a whole lot, right? Like that's a huge part of our job, Like I think of, I'm getting ready to go for an MRI and they ask, their biggest question is, are you cost of, like they're not really worried about my emotional state. They don't, you know, ask
Mhm.
me, how you doing today? Well, I mean, to be kind, I think they do, but they're not asking any questions that are outside their scope of practice, right?
Right.
They're not
Mhm.
trying to get to know me. They're not trying to lighten the load. It's just like, okay, right? Because the reality is also that they're on a time crunch, right? We're on a time crunch to like get the patient in, get the patient out, get to the
Right.
next patient, right? So I think it's such a balance for all of us, right? To like expedite, but with empathy and compassion,
Yeah.
right? And a mix of technical support, right?
Right.
Without giving results, right?
Right. Yes.
So I think it's a pretty complex job that I don't think that we really give ourselves credit for, right?
Right.
Of all the things that we have to do that other modalities don't really have to do, you know?
We have the most patient interaction. If you think about the other modalities, they're just not next to their patient for as long as we are.
Right. So, are there any challenges that you have come up with patient education and maybe had a creative way for us?
Um, I'm sure, I'm sure there are. I pride myself on being very quick on my feet and a fast thinker. And let me think of an example. Wait, what was the
Like
question?
one of my challenges the other day, I noticed is a patient came and she mentioned to me, I am super angry, right? And I
Mhm.
said, okay, so tell me on a scale of 1 to 10, 10 being the worst, where are you at with anxiety? And I'm like, and she responded, I'm a 9. I'm like, oh, you're a 9. Okay. And so I started scanning and I'm like, okay, here's the heartbeat. Can you see the? She's like, oh, yeah. And I'm like, okay, tell me, where is your anxiety now? And
Mhm.
she goes, oh, it's about a 5. I'm like, wow. Okay.
Mhm.
Perfect. Right. And
Mhm.
so I went on to explain what our policy, what our procedure is, right? Like, I'm going to take all these pictures, I'm going to type up a report, I'm going to show it to the doctor, I'll come back and let you know what the
Mhm.
doctor thinks, or sometimes the doctor comes in and goes over everything with you, right?
Mhm.
So by the time she left, I said, okay, so where are we at with your anxiety now? Now that you're done, where are you at? She goes, oh, I'm at a 0. I'm great. I feel one, and I thought, wow, that was kind of the first time that I really quantified it
Mhm.
or helped her quantify it. And it gave me the satisfaction of, okay, whatever I did worked for
Mhm.
her, right?
Right. Mhm.
And so I thought, oh, I learned something there. I thought that was a good
Yeah,
way of helping the patient identify where they're at and how
mhm.
to move through that.
Yeah.
Right.
Yeah.
So I think that was a challenge for me,
Yeah.
right?
Definitely.
With anxiety. Right.
Mhm.
So now I kind of like, ooh, that's in the toolbox. I
Mhm.
might use that again, you
Right.
know.
Yeah. Um,
So
yeah, that's great. I think I have had mainly, I guess the biggest struggles I've had is when I do have people come in worried and I do find something that is concerning. So I think that's probably the hardest to balance because you don't want to, of course, you can't tell them, but you also want to keep the mood light. And it's this gentle balance of keeping them calm for now, knowing that they're going to get these bad results shortly whenever they see their doctor again, because where I work, they don't get instant results. But so yeah, that's a difficult one to balance. And I try to not discuss anything regarding anything technical, anything about their symptoms, anything about why they're there. I kind of try and move away from that. And act like act like I'm not even scanning them. We're talking about something completely different. Let's get your mind completely off of what we're doing here and
yeah.
you're not you're not gonna leave worried.
Right.
So that's the difficult one. Um, and I think when people come to me, if I have a patient, just like you said, if I have a patient coming in saying that I'm really anxious, I love your idea. I probably would say, well, what are you anxious about? What's going on? Um,
Right.
how, like, what's your biggest concern?
Yeah. Yeah. I've used
And
that.
then, yeah. And, then I just kind of move from there. Well, my biggest concern is that I have, an ectopic pregnancy. Okay, well, why do you think you have an ectopic pregnancy? What's going on? Do you have any pain? Do you have any? Okay, well, you have no pain, and well, that's good, but we're going to find out in a second, and yeah, just work off of where they lead you.
Right. Right. Yeah. And address the most concerning aspect for them.
Right.
Right. You know, yeah, I think that's a great idea. Super. Are there any stories that kind of stick out to you as far as overcoming the challenge or how educating them has really kind of created a big impact for a patient?
I actually had a patient not that long ago. I forget what I was scanning on her. I think I was just scanning a lump. I think it was like a lipoma. And she came in, and I had scanned her pelvis about a year prior. And I don't really remember her because we have so many patients. But
Right.
she said to me, she said, whatever our conversation was, I know she came in for postmenopausal bleeding. And I guess she was asking me questions about why she would be having postmenopausal bleeding. And I explained, there's a lot of different reasons, but one of the main concerns is endometrial cancer. That's a big reason why we're wanting to check. And she came in last week and said that I had scanned her pelvis, and because of the conversation we had, and she pushed her doctor to get that endometrial biopsy, which was positive, and she had a full hysterectomy. And she gave me a hug. She said, I'm totally fine now. But she said, you told me that that's one of the things to be worried about. And she said, then I got a little worried about it, and I made my doctor do it. So that was pretty great to hear.
Yeah, so you kind of really empowered her to take control of her own healthcare, right?
Yeah, exactly.
Yeah.
Uh, because I have heard stories, some that are, people close to me, where their doctors haven't really listened, or they haven't really, um, gone for the diagnostics or the treatment that I think that these patients should have. So just empowering someone with the knowledge, this is a sign or a symptom of this disease. Just giving someone that knowledge is now putting it in their hands, that they know and they understand, and you they can do what they want with that. And they can push for treatment options that they may not be given by their doctor.
Yeah, when I have other friends outside of, everybody has other friends outside of medicine and our job, hopefully, right? And when they ask me, I find that that's really the main focus that I have is just to help empower them to ask more questions or ask a more specific, or and the other thing I kind of am, and it's not to put down any physician, but if you don't feel comfortable with the physician you're with, there's plenty of options here in the US, right? Like, you definitely need to feel comfortable with the physicians, that for the simple fact that if anything goes wrong, you're going to look back and think, I wish I would have changed. I wish I would have found a different doctor that I felt more comfortable with. And maybe this wouldn't have happened. Right.
Right. Mhm.
So yeah, I always encourage people to kind of follow their gut or listen to their gut, right? And if you don't feel comfortable, then you have every right to move, and get a different physician, and that you feel more, because if anything ever goes south, that's the first thing you're gonna, man, I should have switched to it, right?
Right.
And then maybe this wouldn't have happened.
Mhm.
And so you don't really want to live with a regret, right?
Right.
Listening to your gut and feeling comfortable with the care that you're getting is, I think, huge, and vital. And I think in my own journey too with health, you're learning your body, right? And so sometimes you don't know
Mhm.
and
Exactly.
so talking to a physician or someone in the medical to know, well, what have you heard that I could do? Like you said, you encourage that patient to get biopsy, and she really kind of advocated for herself to do that, and has probably saved a lot of time and heartache with less chemo or whatever, right?
Yeah.
Which could really affect the quality of their life.
Exactly. I find myself saying a lot, why don't you ask your doctor about this? Or why
Yeah,
don't you ask your doctor about that? And it's just kind of like I have an idea, I know what it is, but obviously not going to say that. But I think you might want to talk to your doctor about this. Why don't you say this specific thing that you just told me? Tell that to your doctor.
yeah,
Or pointing out different different symptoms that they might not have discussed with their provider. Yeah, I think you need to tell them that. Um,
yes,
and that seems to be helpful too. Why don't like I said before with the sound waves, why can't we see intestines? Well, X, Y, and Z. There are other studies that can see that much better, like maybe a
right,
CAT scan, or maybe an MRI would work for you. There are other
right,
studies that can be done. So if you're not getting any results from this test, your doctor might want to order something else.
yes.
And I say that too because, it's kind of putting that expectation in the patient. Okay, well, if they didn't find anything and I really think something's wrong, we need to keep looking. Like there's other things that we should do, and
Right.
they should be advocating to do that.
Right. And I think about my own experiences sometimes even outside. Like I've been divorced, right? And so I had to enter into the legal field, right? And so when I entered the legal field, in which I knew nothing about, right? I really valued people who could tell me, okay, what to expect, right?
Exactly.
And what are my options? Is there
Mhm.
any other way to look at this? Is there any other way to get this done? Is there any other way to expedite this or process this? Or, like I've
Right.
learned to ask a few more different kinds of questions just to understand that process of the legal field, right?
Yeah.
So I think, I remember how scared I was and I didn't know, and there was so much unknown, and there's this hurry up and wait. And that's probably what our patients are feeling, right? Like, I don't know this field. I don't know what's going on. And I just know to do what the doctor tells me. And this is what he's told me. And I still don't feel good, or I still don't know what to do or ask or how to move forward.
I don't
And I
understand
think
anything that's going on.
yeah,
Yeah.
and although it is our job to kind of advocate for the patient, it's also, I think, our job to help the patient advocate for themselves as well, right?
Yes.
So, and I think they learn that a lot in nursing, right? Nurse tell me all the time, it's our job to advocate for this patient, and so I've learned a lot in that process of being in a field outside of medicine that was just so like, I don't understand. I don't know this language. I don't know
Yeah.
what that means, you know. And so it's really kind of made me a little bit better at educating patients when I had that experience in my.
Absolutely. Yeah, it's so important, and just like that, you go into a field or you start doing something that you know nothing about. You're like, whoa, this is probably what my patients feel like.
Right.
Um, going into something, and it's not that you don't have the ability to understand, you just don't know.
You don't
And
know the questions to ask,
yeah,
right?
you
You don't know.
don't
Yeah.
know. So, and one of my favorite sayings is, "We don't know what we don't know." Um, there's so much out there. Um, so I see that exactly as how our patients must be feeling. And
Yes.
I have a story that I wanted to share. This is also why this is such an important topic to me.
Yeah.
So prior to me being an ultrasound tech, I myself was getting an ultrasound. I was getting a pelvic ultrasound, a transvaginal ultrasound. And so it was done at the OBGYN's office. Um, and when I got there, she asked me to empty my bladder. Well, I had been holding my bladder because they told me to hold it, they told me to hold it first, but it was only a TV. So she told me to empty. So I do. I go to the bathroom and go in the room. She starts scanning and she says, "Did you empty your bladder?" And I said, "Yeah." She said, "Huh, your bladder's still pretty full." Oh, okay. That was it. That was the extent of the conversation. So I'm having pelvic pain. I'm not knowing what's going on. Days go by after the ultrasound. I'm still not getting my results. Now I'm thinking in my head that I have something wrong with my bladder and that it's a bladder issue and that I'm not emptying.
Able to empty. Yeah.
I'm not able to empty. So, and this physician, finally, when I spoke to him about my normal results, I said, "Well, the tech said I wasn't emptying. I didn't empty my bladder, and I think I might have a bladder issue." And he said, "Oh, well, you'd need to see a urologist for that." So I made a urologist appointment, and I went to the urologist, and they kind of looked at me and was like, "Nothing's wrong with you." But that's where my head went from that little comment from the tech telling me I didn't empty my bladder all the way. So I find myself all the time with my patients. If I ask them to empty and I go to do a TV and they're still full, I will say, "This is common. Sometimes you don't empty all the way. If you're holding your bladder, it happens all the time." Because I don't want anybody to have that experience. That was so.
Yeah, because I think nerves really play a huge part in it, right? And when I get nervous, my kidneys go into overdrive, and I feel like I have to go to the bathroom all the time, right? And so part of it could be nerves, right? Or when you send a patient to the bathroom, you're like, okay, hurry, I got to go to the bathroom. And then you're not emptying all the way because you're in a hurry, right?
Yeah. But
So,
whatever the reason is, people need to understand that just because they didn't empty all the way doesn't mean that there's something wrong.
right,
It can happen. It's normal. Don't freak out and make unnecessary appointments, or, think something's wrong with you when nothing's wrong with you because someone
right.
said and without explaining it.
Right, right. So where do you think like the future of patient education is going? Do you think it really is going to still fall on us as healthcare providers, ultrasound specifically, to continue to educate our patients, or how do you feel that will go, in our
I think it's educating people is just a constant. I think everyone should be doing it. If you know something and you're in a position to educate someone who wants to know the information and will benefit, I think that's ever should go on forever. Um, my real vision, I think, which who knows if this would actually happen, but I would love to see patient educators within hospital systems, within doctors' offices, someone with medical background who can kind of piece things together and guide the patient. Because so many people are so lost in what's going on with their healthcare and their bodies. And I think it would be really great if there was a dedicated person that someone could go to, and that person would actually spend time and make sure that they understand. I think that's something that's really needed in healthcare as a whole. And it
Yeah.
doesn't seem like people are getting the knowledge that they deserve all the time.
Almost like a patient care advocate or something,
Yeah,
where kind of walk you through point by point,
right,
I always make sure I try to tell my patient that the results will be in your chart by X, or it'll be faxed to your doctor in X amount of time or whatever. So they have an expectation, or they know when that's going to happen,
right,
right? So they have that expectation of, okay, my doctor should have it. So if I call to get the results, then I'm not asking them for something that they probably don't have, right?
right.
So, yeah, I think, the other day I was scanning a patient and they're like, my doctor doesn't get the results. And I'm like, our reports are faxed automatically at the end of every day,
Mhm.
and so they should have it within 24 hours for sure, you know,
Right,
just so it helps the patient be able to kind of take control of their own care and move it forward and just say, no, they told me that they fax it, you know, is there any way you can look again for it possibly? It's tough. It's a hard thing, I think, for patients to navigate, and we're kind of just trusting that the system is doing the best for us, right? Because there's so many moving parts
mhm,
that little things can get overlooked, right? The fax machine didn't go through on that one patient because the number was one number off or something, like,
mhm.
unless somebody really kind of follows through and checks up on that, it can be lost in the shuffle, I think,
Exactly. Yeah, yeah.
so what would be, like, say, 3 or 4 things as a takeaway that you would recommend every sonographer do to really make patient education kind of a routine?
So working on that emotional intelligence and being able to read your patient on where their mindset is, what they need, what they're looking for. I think that's super important. And some people are really great at it and have that skill. And other people, it's something that they should work on, or they could benefit from working on. Um, and thinking about the patient as someone you care about, what would you like them to know? And presenting it to them in a way that is respectful and speaks to them as an educated person who is not unable to understand what they need or understand healthcare in general. I think those are probably the most important points. Just get to know your patient, see what they need, care about them like it's somebody that you care about, and speak to them and give them information in a way that empowers them and is respectful.
Yeah, I think those are great takeaway points to remember, right? Remembering, okay, if I were the person on the other side of the table, right? Instead of giving the care, if I were the patient, what would I want, right? Ask yourself that question. I think empathy and compassion, I think, is always a part of our occupation, right? We're always giving that out, but being a good listener to hear, like you said, where is the patient coming, knowing those questions to ask as far as where their anxiety level, what are they most concerned with. This week, the thing that I really had a takeaway from, what I thought was, oh, this would be good, is just, okay, where is your anxiety level now that you're leaving, right?
Right.
Or do you have any other questions about any of this before,
Mhm. Yeah.
just to kind of wrap things up with where they're at and help them kind of think, okay, where am I at? Do I have, and where? I think
Mhm.
those are great takeaways, like you said. Always working on yourself to improve your emotional intelligence, everything. And of course, you're going to have those difficult patients that, right, to please them. You just hurry them along and hope that they aren't too dissatisfied with your hurrying along. But
Yeah.
yeah, I think it's huge. And I think in our society in general, we're not good at listening. And I think what I heard from you today, as well as is listening to your patient, right? Really seeing where they're at and where they're right. And we're not overstepping our boundaries. We're just educating them on what, right? I think ultrasound gets a few more questions because we're in such close personal space with, as opposed to other modalities that don't enter that close of a space with that patient,
And we're already there. We're sitting with the patient.
Right.
I mean, if you're a newer tech and you need to really concentrate on, that's fine. I completely understand that. Or if it's a hard study, but we're there. And if you've been doing this for many years, most people can talk and scan at the same time.
Right.
So you're already there. Why not? Um, you know, help your patient.
Yeah, I agree. Well, thank you so much for sharing your thoughts and your experience with us. And I hope that anyone who has been scanning for any amount of time can always kind of take a look at this part of our practice and take it to the next level, right? Even learning one more question to ask that is maybe a little bit more clarifying for our patient. That'll make all the difference in the world. I know there's some places that I've worked where patient satisfaction is huge, right? And so apparently it affects some reimbursements from insurance to how satisfied your patient. So I think this whole process that you've shared with us is just vital and really impactful for us to be able to get patient satisfaction scores high, right? We don't want a patient to leave mad because sometimes we know they're going to leave and get bad news, right? So leaving, having a good experience, having a good understanding of the system and what we can see and what we can't, and different things like that, I think is really vital, important. So I think that will only help our patients.
Yeah, definitely.
So thank you so much for your time. I appreciate it. This has been a wonderful conversation and a good review. And anytime I do a podcast, I'm always kind of thinking ahead of time and focusing. And I'm always surprised at what kind of comes to my head or what kind of experiences I have that week when I'm thinking about that ahead of time, So I appreciate the attention given to really know that if we focus on take us to the next level. So thank you. Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend and remember to keep your frequency high.